47 days. That's how long it had been since the 24-year-old woman lying on the emergency room gurney had last gone to the bathroom. Her abdomen was so swollen the resident on call quietly asked if she might be pregnant. She wasn't. Her heart was racing, her blood pressure was sliding, and somewhere inside her, pressing against her ribs, was something the imaging team would soon describe, off the record, as the most extreme case they had ever seen. She was 24 years old, a graduate student, quiet, polite, the kind of person who apologized to nurses for taking up their time. She lived alone in a small apartment, worked long hours at a laptop, and ate the way a lot of young adults eat when life gets busy: coffee in the morning, something fast for lunch, takeout at night. Vegetables were rare, water was rarer. Her bowel habits had been irregular for years. As a teenager, she sometimes went 4 or 5 days without a bowel movement and thought nothing of it. In college, it stretched to a week. By her early 20s, 2 weeks between trips to the bathroom felt almost normal. She had mentioned it once to a primary care doctor who recommended more fiber and more water. She nodded. She didn't follow through. Like millions of people, she assumed her body would eventually correct itself. It didn't. The trouble started quietly, the way it almost always does. Around day 10, she felt full after only a few bites of food. By day 15, the fullness had turned into a dull, constant pressure low in her belly. She told herself it was stress. She drank a little more water. She skipped dinner a few nights thinking that an empty stomach might help things move. By day 20, her abdomen was visibly distended. Her jeans no longer fit. She started wearing loose dresses to class. When friends asked if she was okay, she smiled and changed the subject. By day 30, the pain had a rhythm of its own, a deep, cramping ache that woke her up at night. She tried over-the-counter laxatives. She tried prune juice. She tried sitting on the toilet for an hour at a time, breathing slowly, willing her body to cooperate. Nothing happened. By day 40, she had stopped eating almost entirely. Even sips of water made her feel sick. She was losing weight everywhere except her abdomen, which kept growing. She didn't go to the hospital because she was embarrassed. She didn't tell her family because she didn't want to worry them. She told herself she would handle it. On day 47, she collapsed. A neighbor heard her fall and called 911. When the paramedics arrived, they found her conscious but pale, her skin cold, her pulse thin and fast. Her abdomen was rigid to the touch and swollen to the point that her ribs looked compressed from below. She could barely speak. The only thing she managed to whisper again and again was that she was sorry. In the emergency department, her vitals told the team they were running out of time. Her heart rate was over 130. Her blood pressure was dropping. Her temperature was creeping up, a sign that something inside her was beginning to fail. Lab work came back with elevated white blood cells and signs of dehydration so severe her kidneys were starting to struggle. The attending physician pressed gently on her abdomen and felt something that didn't belong there, a hard, immovable mass stretching from her pelvis up toward her ribcage. He ordered imaging immediately. Within minutes, she was being wheeled into the CT scanner. What the scan showed silenced the room. On the screen, her colon was no longer recognizable. The large intestine, which normally curves through the abdomen like a soft picture frame around the small bowel, had ballooned to nearly 4 times its usual diameter. From the lower left, where the descending colon meets the rectum, all the way up and across, the entire structure was packed solid with hardened stool. The mass extended into her rectum and pressed upward against her diaphragm, which explained why she had been struggling to take a full breath. The radiologist estimated the impacted material weighed somewhere between 15 and 20 pounds. The walls of her colon were dangerously thin, stretched almost to the point of tearing. In several spots, the tissue showed early signs of ischemia, meaning the blood supply was being choked off by the pressure. If even a small section ruptured, the contents would spill into her abdominal cavity, and the resulting infection would likely kill her within hours. The surgical team was paged. The anesthesiologist was paged. a bed in the intensive care unit was prepared. What had started years earlier as a habit of ignoring her body had become a medical emergency measured in minutes. To understand how a body reaches this point, it helps to know what the colon is actually doing every day. The large intestine has one main job: pull water out of digested food and turn what's left into stool. When everything is working, that stool moves steadily toward the rectum, signals the brain, and gets passed within a day or two. When it doesn't move, the colon keeps doing its job. It keeps pulling water out. The longer stool sits, the drier and harder it becomes. The harder it becomes, the harder it is to pass. The harder it is to pass, the longer it sits. It's a loop that feeds itself. This is called fecal impaction. In mild cases, it causes discomfort and bloating. In severe cases, the stool forms a dense, concrete-like mass that the body simply cannot move on its own. As the mass grows, the colon stretches to accommodate it. Stretch it far enough, and the muscle fibers in the colon wall lose their ability to contract. This is called megacolon. A colon that can't contract can't push anything through, which means even if the impaction were somehow cleared, the organ might never function normally again. Stretch it further, and the wall thins. Thin it enough, and it tears. A tear releases bacteria into the bloodstream. That's sepsis. That's the line between a difficult recovery and a fatal one. Before we get to what happened next in her case, and how her recovery actually unfolded, there's something worth pausing on. Most people watching this right now are quietly recognizing pieces of their own story in hers. The bloating, the sluggishness, the days that stretch into a week without anything moving the way it should. There's a short presentation that explains an unusual approach a lot of people have been turning to, built around a single ingredient, sometimes called an underwater gut superfood, that's been used for thousands of years to help the body clear out the buildup that quietly accumulates in the intestines. No restrictive diets, no expensive probiotics, no medications, just one small addition once a day. If you want to see how it works, point your phone's camera at the QR code on the screen right now, and it will take you straight to the full presentation. There's also a link pinned at the very top of the comments so you can tap straight through from there. Take a look, then come right back, because what happens next in this story is something every single person needs to hear. Now, back inside that operating room. In her case, the team decided surgery was the only option. Manual disimpaction and enemas could not safely move a mass that large, and the colon wall was too compromised to risk further pressure. Surgeons performed a partial colectomy, removing the most damaged section of the large intestine. A temporary colostomy was created to let the remaining bowel rest. The procedure took several hours. She spent 11 days in the hospital. She lost nearly 30 pounds during her recovery. Months later, after the colostomy was reversed, she began the slow work of teaching her body how to digest, signal, and eliminate the way it was supposed to. Today, she lives on a strict regimen of fiber, hydration, daily movement, and scheduled bathroom time. She will for the rest of her life. Her story is extreme, but the path that led there is not. Millions of people quietly ignore the same early signals every day: the bloating, the discomfort, the embarrassment that keeps them from speaking up. The body is patient, but it is not silent. It asks for water, it asks for fiber, it asks for movement. And when something feels wrong for weeks at a time, it is asking for help. The strongest thing anyone can do is listen early.